As you'll know, we have 5 cases that we believe were locally transmitted in Miami Beach, and that was confirmed on Friday. We have total in the state 37 cases of local transmission. Right now we have 2 areas, both very small. The Wynwood area is less than a square mile, and the Miami Beach area is about 1.5 miles. We have, because of the mosquito control efforts in the Wynwood area, along with the education efforts, we have been able to reduce the footprint by about 17 blocks now. So we've had progress there. We have tested about 3,800 people around the state. We have about 6,700 test kits for active Zika right now, and 2,600 for Zika antibodies. We have been allocated out of the state budget $26.2 million worth of resources to use with regard to a variety of things, including mosquito abatement, working with our county health departments. And by the way, you have a wonderful county health department here. They do a wonderful job. We've already fulfilled about $700,000 worth of requests from Miami-Dade County, and we have a request in. We're going to fulfill another $5 million worth of requests for Miami-Dade County. We have some ask out to the CDC. We would like 5,000 Zika antibody test kits. We'd like 10,000 Zika prevention kits. We would also like a plan from FEMA. We asked for a plan from FEMA starting June 1st. We still have not received that. We haven't gotten the funding for the Zika prevention kits. But we have very good coordination. We started this in February. You have a sort of a timeline of actions that we've been taking around the state since February, with the goal of having our Department of Agriculture, our Department of Health, our county health departments, whoever is responsible for mosquito abatement around the state, work together, and that's worked very well. So that's, I think, why we don't like the fact that we have 37 cases of locally transmitted Zika in our state. However, if you put that in perspective, we have probably 20.6 million people live in our state, and we probably already had 60+ million tourists in our state. We have our Department of Business and Professional Regulations is working with our hospitality industry, our hotels, our restaurants, and our attractions, to work with them to get the word out. We've got to do everything we can to get rid of standing water, to use bug repellent, to use protective clothing. Our Department of Economic Opportunity has been working in the Wynwood area themselves and with FIU to provide whatever services they can. We're starting to do the exact same thing in Miami Beach. We have, clearly we care about everybody in our state, but this, as you know, this disease impacts our pregnant women and child possibly the worst. We have offered assessments and tests to every pregnant woman in the state, over the entire state, at all of our Department of Health locations. We are doing daily updates from our Department of Health. Our schools are, one reason we're here, we just visited a local school, middle school, and they have, the Department of Education has a teacher's kit to help educate our students about the importance of getting rid of standing water, wearing bug repellent. Our Department of Health is working with our school districts around the state to make sure they have bug repellent. You have a very good school district here, which does very well. Superintendent Carvalho does a great job. So we're working hard to one, make sure everybody understands what we all need to do, and on top of that, provide what resources the state can provide. We are still asking the federal government to be a partner in this, and I know Congressmen and Congresswomen that are here are supportive of the federal government being a partner. This is an international issue. It's not just a Florida issue. We're at the tip of the spear because of our location, because of the number of people that travel to our state. We have just under 500 people in our state that have travel-related Zika, but we have a very aggressive program to work with our counties, our mosquito boards, with our Department of Health, our Department of Ag, to make sure that we do everything we can to both educate and eradicate mosquitoes. At this point, I'll turn it over to our Surgeon General, Celeste Phillip.
Thank you, Governor, and thank you all for your time and attention today. I wanted to just take a few moments to walk through the process that we go through every time we find that there's a new case anywhere in our state. There's a epidemiological methodology that we use to approach every single time we identify that there's a person that we think has a case of Zika that's locally transmitted or not travel-related or sexually transmitted. And that involves getting a very detailed history from that person that includes understanding their movements. So where do they live, where do they work? As we've been going through this process in the last few months, we've identified that sometimes it might be an outdoor event of interest where we have to ask questions about whether or not there may have been exposure to mosquitoes. So that first process of where we're asking questions, looking at whether or not we should test other individuals in that household, co-workers, people who may have been at that event or other places that they frequent. It can take several days to weeks for us to complete that process. And we do that for every single locally acquired case that we have in our state. The majority of them we find are isolated cases. So we go through that process, and in the end, after asking lots of questions and investigating different areas, talking to lots of different people, we find there's just one case in that area and we consider it closed. As we learn about new cases, we have to look at the locations of existing cases, travel-related cases, to see if there's a relationship. And again, every time we add a new case, we're going through that whole process every time. So now that we are at this point where there are many cases that we're tracking, it's very important for us to make sure we stick with that process and that we are very careful with making those relationships. As soon as we do, we then look at the CDC criteria for 2 or more cases within a mile of each other, within a month of each other. And that's when we begin the process of saying that we think there's another area or a new area of local transmission. So I know there have been questions about when we make this decision, and I just wanted to explain the process that we go through every time. Now that we have a second area, we continue our efforts working very closely with the Mosquito Control District and their team members, with the commissioner and his team, to make sure that we are very aggressive in different options that we have. Each area is different. Aerial spraying is not always appropriate if you have tall buildings, which is the case in Miami Beach. So there are considerations for each scenario. So we take that very seriously, and we work with our partners to make those decisions and to keep everyone informed. Our priority population, pregnant women and their growing babies, is why it's important for all of us to do our part to protect ourselves from getting a mosquito bite that could then be transmitted to a pregnant woman. And so every day when you are outside, it's really important to continue to wear mosquito repellent on clothing and skin. And during this rainy season, this time of the year, all of us paying attention to standing water, looking for any containers or items that can hold water, and doing our part to make sure that we either take care of it ourselves or if it requires making a phone call to the Mosquito Control District for us to do that. Those actions, along with the efforts that are ongoing, will make a difference, and we are hopeful that we will be able to quickly mitigate additional cases in Miami Beach. So far in Wynwood, knock on wood, we've seen that we've gone several weeks without any new cases. So we will continue those actions and continue to share information as we get more. Thank you.
Thank you, Governor. I'm Adam Putnam, the Commissioner of Agriculture, and our role in this is a supporting one, supporting the Department of Health's efforts with our responsibility being on the mosquito control side and supporting the local governments where the rubber actually meets the road. So we would all rather be here simply to celebrate the start of another great school year in Miami-Dade County, and we would all love to be celebrating any number of other things. Unfortunately, we have a situation that requires all of us working together to resolve as quickly as possible so that we can look back on this as an education on how, yet again, Floridians rallied behind one another and came to each other's aid and supported one another and successfully defeated this scourge. The Miami-Dade mosquito control men and women have done an extraordinary job. They're working around the clock, writing the response in the United States as they go, in the sense that this is a national issue, as the governor has pointed out, but it's here in our backyard. And I want to acknowledge the hard work and leadership that has come from those men and women working around the clock, going door to door. As the Surgeon General said, each of these locations requires a different response. The second core area that has now been opened does not lend itself to aerial spraying. You will see more backpack and truck methods being used to spray for the mosquitoes. The data shows that the combination of adulticide and larvicide does result in a dramatic reduction in the mosquito population. But we're not ever going to go to zero. And so the public awareness portion of this is incredibly important, as we require the assistance of all Floridians and visitors to help us reduce the habitat for these mosquitoes and do that in a way that reduces the risk that there's going to be a mosquito-borne transmission of the illness. And so when you look at the data from what we've been seeing in our traps, we have trapped 32,000 mosquitoes statewide. 6,000 roughly have been here in Miami-Dade County. There have been no positive finds of Zika in the mosquitoes in Miami-Dade County or anywhere else in the state. And that's a very good thing. We do not want to find any positive finds in the mosquito population for all that would represent, in the sense of it being in that population. So we continue to support all of the counties that have mosquito control programs. There are some areas that do not have them, not in South Florida, but in other parts of the state. We play a greater role in those areas. We've also trained private pest control companies who can be our partners in this effort, and continue to work with the governor and the Surgeon General in however role we can to support this effort, so that we can all come back together and celebrate having successfully defeated Zika in South Florida. But your efforts are enormous to our success. You are where the rubber meets the road. We very much appreciate the role the leadership role that you're taking in this. And together, Floridians are going to rise up and support each other, and we're all in this thing together. We've been through other issues, not exactly like this, but Floridians always come together and support one another, and we will in this as well.
Also, part of the funding we've done at the state level, the Department of Health also has contracted with private mosquito bait companies to do additional mosquito control. And by the way, we have, I don't know if you saw, we have a timeline of something we've done. This is how you can get information from the Florida Department of Health on their website. And these are telephone numbers if anybody needs any to get a hold of individuals.
Thank you, Governor. I want to thank the Surgeon General and the Commissioner of Agriculture. I also want to particularly thank Lillian Rivera, the local administrator of the Department of Health here in Miami-Dade County. Her and her team and staff have been doing an incredible job. And thank you on behalf of the citizens of the state of Florida. We all want the same thing. We all want a positive solution to this problem. And we're all in it for the same reason, to help the citizens of Florida. Many of you, if not all of you around the table, know how to get a hold of me. If you can't get a hold of the governor or the Surgeon General, although they return calls very quickly, consider me a resource. I'm happy to help, and as many of you know, this is my hometown too. So I'm happy to be of service and happy to be part of this discussion today. Thank you.
Commissioner, you want to talk about what you're doing on the schools?
Sure. Thank you, Governor. And I'll just say that this truly is an example of government coming together and working together very closely to ensure that we keep Florida citizens safe. And you might not think of the Department of Education or the education area as being included in this area, but I will tell you that we can serve very, very well. And we've worked in partnership with the Department of Health to provide districts and our colleges with information, and as the governor mentioned, a toolkit for teachers. We visited some classrooms earlier today, and one of them was a science classroom, and they were learning about Zika and learning what to do. And I think our students can be great advocates for going home and talking to their parents about what to do, how they can help eradicate this, and the biggest issue being to spill the water. We can't say it enough, to get rid of any standing water, and they learned something, and we're surprised that even a bottled can of water could in fact be housing larvae for mosquitoes. So it's really important that we work together, and those lessons that teachers can use are very practical in nature, and they actually do teach the Florida standards. So it's something that we're very grateful to the Department of Health for working together with us on that.
Yes, sir, President.
Thank you, Governor. Our 340,000 state university system students began going back to school today, and with that we have a campaign, a messaging campaign that's going out to enlist them in our support for the Department of Health and also for our K-12 colleges. Where we're going to engage our students and talk about the virus, but also talk about what we can do on our campuses and our communities to be responsible towards. We have a campaign, we follow the Spill It Out idea, and when we're talking about spill it, spray it. So we want to engage our students in getting to think about not only the behaviors that they need to do for their own personal well-being, but also how they can work across campuses and in our communities to look for opportunities for water out. We are also sending a letter to all of our student newspapers today and hoping to engage the larger community. We're going to be sharing the contact information so that when anyone in the community has a question, we want them to know where they can go. And then at the same time, we will continue through our university research. We have several institutions now that are involved in different stages of understanding this virus, understanding ways to protect individuals, most importantly probably to protect women and unborn children. And we're going to continue to work on that.
We're very interested about the Transit Department's done.
Oh, yes, thank you, Governor, and thank you for all the recognition. Thank you to all of you. I just want to say on behalf of the Florida Department of Health, the job that we're doing at the local level cannot be done without all of you around the table, and many of you outside this table. We are working 7 days a week, 24 hours a day, to make sure that our response is based on the CDC plan and based on our state plan, and making sure that we provide the best information that we can at the time that we have it, based on the science that's provided to us. I want to thank the mayor for his leadership, his courageous leadership, because the response for an arbovirus or mosquito-borne disease needs to be together with mosquito control, right? It goes hand in hand. And he has been very, very courageous in helping us make the tough decisions and making sure that they get done on time, and rightfully so. And this lady sitting next to me right here is connected to me 24/7 because she runs the program actually at the local level, and we have been able to respond very quickly. As soon as we know the cases, she gets the addresses, she's out there looking for those breeding sites and making sure that we do everything that we can in the toolbox to get things done. So I want to thank her and thank the mayor. And now we're working with the city of Miami Beach, so thank you, Jimmy. He's always accessible to us. Thank you, Mayor. You guys are doing a great job in responding. I was out there yesterday with your code enforcement. They were terrific, making sure that we look for those breeding sites. I saw the mayor out there too, responding and making sure that we're looking for those breeding sites and updating those breeding sites. Very important, because we could do a lot on, with the mosquito tools that we have, eliminating them, but the breeding sites have to be eliminated. And thank you for your quick response. We do appreciate it. Thank you to the Wynwood group. You guys have been great in helping us, making sure that we keep the message alive of drain and cover. The businesses have been a terrific partner, and we do thank you for all that you have done to help us keep the message alive, because we have to keep on looking for areas of concern and making sure that people use the right repellent, because we're worried about our pregnant mothers. We're really worried about them. We want to make sure that they protect themselves. And Superintendent Carvalho is not here, but we've been working all weekend with them and last week to make sure we're at the schools, providing the message that we need to provide, and protecting those teachers who are pregnant, who are coming into the schools. That's very important to us, and making sure that the people who live in these communities who are pregnant get the information that they need. So I could go on in summarizing all the things that I've done. That
You've done a lot of education outreach
A
also.
lot of education and outreach, yes. We are, the campaigns that we have are definitely a drain cover, but still the water for the children, right, at the children's level, and making sure that we're out in the community, getting the information, getting the repellent out, getting the prevention kits out, making sure that we have covered everything. And we're doing that every day. We're working with our hospital systems, our big hospital systems, Jackson and UM, and we're working with Baptist Health System, which is a big hospital system. We have several huddles in the morning with them, with all the OBs and OBGYNs, and making sure they have the information that they need. And they too are testing all of the pregnant women with us, together with the F2HCs. The F2HCs have been very active working with us in testing them. And our clinic has been very effective, so thank you for that. That was a good move to test our pregnant women. We have been getting a tremendous response. And that made the OB's life much better by having access to the test. So we do thank you for that. That was a really big move for us. I guess that's not there.
The other thing we've done is we have, as you know, we have a lot of people come into our state through our airports, and so we've tried to make sure that all of our airports have a plan, and Miami Airport has probably been a leader, so maybe you want to talk about what y'all are doing?
Thank you, sir. We've been meeting since the beginning of the year. In fact, when we went through this once before with the Ebola crisis, we stood up certain protocols. Dr. Rivera is involved, Customs and Border Protection, TSA. The mayor was extremely supportive from day one, because clearly this is where people come in and people go out of. So as a result, we've been following all of the CDC protocols to date. We posted travel advisories at our two main immigration passenger entry points. All of our employees have been given cards from the CDC on essentially what to do if you find a passenger is ill, whether the disease is communicable or not. But the protocols are still the same. We run travel advisories over 300 of our LED screens throughout the airport. In addition to the gates where people are going outbound, we run the same advisories. We have standing advisories throughout the airport. I have copies here that I can give you. And we're also treating water. The airport has very big properties where we're looking for standing water anywhere. We're working with Public Works to get the right chemicals to treat the water. And we have periodic weekly and bi-weekly conference calls with all the stakeholders so that we can get up to date with the latest information. And we review our plans constantly. And Dr. Rivera has been great, and the mayor's support has been phenomenal.
You want to talk about what the Department of Economic Opportunity is doing? I know you've been over the Wynwood area.
Yes, sure. Thank you, Governor. We'll be meeting with and talking to businesses about Zika. One of the ways that they can share information is through a business assessment survey. And we'll be gathering that information, certainly pointing to them to resources where they can get accurate and timely information, for example, Department of Health.
Thank you, Governor, and thank you again for being here. And I'm very happy to hear that there's a check in the mail, because we'll be waiting for it. And we have spent a lot of money here, but we'll do what we have to do. Thank you, Commissioner, for your friendship, but also the communications that we've had in your office and the cooperation that we've had. I want to thank Mayor Levine and Manager Morales for the work that they've done ever since we found out we had a problem in Miami Beach. Super aggressive. Code enforcement is one of the keys to knocking down the mosquitoes, and I think you guys have done a terrific job. We've been
How
teaching.
many people really know what code enforcement can do? doing tonight, let everybody know. Because they've really been a big part of it.
Yeah, and code enforcement has been going around, and because code enforcement, there are violations that actually lead to weed arrest. And so what code enforcement does is maybe you have dumpsters that are open, if you have containers that are scattered about, if you have an unkempt either multifamily home or a business, standing water, et cetera. Those are all code enforcement. Those are all violations, and so we need aggressive code enforcement in order to rectify that. I know that when I was with the CDC director and we went around this area, we noticed certain things, and we communicated that to the city of Miami. Today, there's certain things here that are actually contributing to this, and we need everybody's help. And so we've been preaching prevention. Prevention is drain, cover, protect yourself, and also personal responsibility. Every person, it takes all of us to protect all of us. And we want to protect pregnant women in our community, or to be pregnant women. And if I never get bit, I will never be infected, and therefore I will never, if some mosquito bites me, and I will never infect anybody else. And so really it's about us. And so yeah, as government, we go out and we try to knock down the mosquito population. We're never going to get down to zero. What we're trying to do is reduce the risk. At the end, to reduce the risk to zero, it takes us to do that. And so that's been our message over and over again. It's something that the mayor has been saying over and over again, everybody in this community. And so our issue is we have folks here from the Wynwood area. Obviously, the boundaries and the travel advisories have had an economic impact. We want to make sure that we're always protecting our citizens and our visitors alike, but it does have an economic impact. And so in my letter to you, Governor, you'll notice that I said, hey, we have an economic impact to Wynwood. Now we have to add Miami Beach in a number of ways. Number one, the businesses themselves are suffering, and we know. We expect some impact to Miami Beach. Tourist dollars that we get to fund culture and other programs are probably going to be affected. And so we would hope that the state could help us out, in that matter too. We are committed. Alina is my deputy mayor, but I actually call her General Alina. Alina Dubac, because this is a war, and I said this has to be like a war against the mosquito, and we're waging it. We've upped our game, and we have over 100 crews out in the field every day to knock down the mosquito population. Put out the word about prevention. Put out the word about personal responsibility. And I spoke to the superintendent last week. He was worried about spraying, aerial spraying during school time, and we delayed the final aerial spray until Saturday. So none of our children are going to be affected in any way, shape, or form. And I believe that's the last aerial spraying that we have on schedule anyway. If things change in the future, we may do something about it. But we have no plans to do anything of that kind of aerial spraying in Miami Beach. So again, thank you for the check that's about to come, and I'm sure that I'll be writing some more IOUs to you, or hopefully not IOUs, but hopefully help me. Okay. And again, thank you for your help. And then our federal partners, we need you all to pass a bill. The CDC director was fairly confident that we can have some kind of vaccine. And you know what? That's what we need in the end. Put this behind us and put that in the rearview mirror. Because fighting mosquitoes is tough. Mankind has been fighting mosquitoes for a long, long time, right? And not very successful at it. So the vaccine is going to be
20.6 million people here. We'll have 102 million tourists. So, we're
that's correct, but we never have been able to get down to zero, right? And so there's certain areas where we can do it, but there's certain areas that they're still there. So again, thank you very much, Commissioner. Thank you, Surgeon General, and everybody. And Lillian, you've been great. And I don't know if you know what happens here, but we have a call, a meeting every single day. What's happening, and how do we work together? Everything's not rosy, Governor. There are some times where communications has broken down a little bit, and we want to make sure that doesn't happen. Okay, so that we work together. And again, thank you very much for having us, Governor. Thank you also.
Did going to add something first.
Yeah, well, Governor, Lieutenant Governor, thank you for bringing us together. The governor, his leadership on Zika has been admirable. He went to see us about Zika many months ago before anyone even knew what it was, because he knew, like we knew, that we were the state that would most be exposed to this threat. So I'm very grateful to you. When Congress gets back on the 6th of September, there are two priorities. Keeping the government funded past the 30th of September into the new fiscal year, and passing a package on Zika response. Now, it's very important for everyone to know that today, the Zika response is being fully funded from the federal level. Dr. Frieden confirmed this to me when we gathered with him here in this building a few weeks ago. And the key is that after September 30th, those funds will start running out. So it's imperative for Congress to act as soon as possible. I know that Ms. Wilson and Dr. Wilson are willing to go up today if they call a session to get this done. The Senate could get this done today with 2 senators. Whatever the case is, before September 30th, it's critical for us to act, and we've been gathering a lot of information and opinions from local leaders like Mayor Jimenez, who also very early on was very proactive and is very on top of this issue. So that's a fly, not a mosquito. So that we can influence that legislation to the benefit of our state. But I'm very grateful to you, grateful to the mayor, and to everyone who is working out there. I will say just one suggestion for the governor, the Department of Health. When we put out these maps, I think it inadvertently creates a false sense of security for people who are not in the designated areas. And I know it just from constituents coming up to me saying, oh, well, that's a problem in Alapata, it's now a problem in Miami Beach. Well, all of us in South Florida are exposed, and all of us need to be a part of the solution. So if you could, when those maps go out, if you could accompany that with the message that these are the areas where we have identified local transmissions, but everyone should consider themselves exposed.
So, thanks. If you do talk to Dr. Bean, we've asked for 10,000 Zika prevention kits. We haven't gotten funding for that. I'm sorry.
I thank you so much for being here and all of the input, and every day I learn something new about you. And I think at the very onset, we need to say that the President of the United States, Mr. Barack Obama, came to Congress and asked, demanded $1.9 billion to fight Zika. This was before any, just like Carlos said, we didn't even know what Zika was. But we knew that Florida was vulnerable because of the peninsula. We always have hurricanes, we have tornadoes. So we began to fight, we began to write letters, we began to push, we began to prod, and we began to lobby. And what we have to do now is make sure when we go back that everyone is on the same page, that everyone listens to what the President has said all along. The Senate did come up with an offer of $1.1 billion, but then they began to load the bill to avoid the bill. And we can't do that. We need a clean bill for either 1.9 as the President asked, or 1.1 as the Senate agreed to when we go back. So that is our agenda, to work for the citizens of Florida. And I am especially motivated because I represent the epicenter where it all started, which was, to my chagrin, was truly amazing to me. So Carlos and I think the whole Florida delegation, I don't think there's the Republicans and Democrats, we're going back loaded with information and with fight and fully focused stuff. And I want to thank the mayor for keeping my office filled with whites. I mean, we have so many whites, and as soon as we give them out, I mean, these people are tuned in. They're, in Overtown, Liberty City, Carroll City, they're coming for the whites. So thank you so much for keeping us supplied, and we appreciate everyone and everything that has been happening with this fight. Because it's a
always.
It's a problem.
Mayor Levine?
Governor, thank you for coming, and for your entire team. Thank you all for being here. I think Mayor Donetta said it all very well, and we're working very closely with the county. We're in constant communication with Alina, and we're doing all the necessary things to be as preventive as possible. There's only two things I wanted to bring up. I think everything else was said. Number one, I personally invite you, the next time you come to Miami, so let's hold this on Miami Beach. And I hope that you come back soon. And we all know that Miami Beach is one of the top economic generators in the entire state. So I think your presence on Miami Beach will go a very long way. And the second thing, of course, is the 10,000-pound gorilla in the room, which is communication. I know that the mayor alluded to it, but I'll probably be a little bit more direct. I think it's important that myself, city manager, our counterparts of the counties are getting timely, accurate information as fast as possible. Because, as you know, we have our constituents, we have our businesses, we have all the major health areas we have to deal with, and we just got to have that information. So I hope that after this meeting, we can be assured by you and by your team that we will get information as fast as possible.
So, just want to assure everybody, whatever information comes out from the governor's office or the Department of Health will be timely and it will be accurate. And we're going to make sure what we put out is information that we can stand behind. That's what we're going to do. So you want to talk about what the, and by the way, when we finish, one thing I want to ask is everybody worries about a lot of things. I just want to make sure if anybody has any unmet needs that they've called and asked me about, that we respond to. Because if you look since February, I've been traveling the state, holding roundtables, calling mayors, and making sure that there's an unmet need. We do everything we can at the state level to fulfill it. Talk about what the court's doing. You want to talk about it? Oh.
Hi, Governor. How are you? So we have a couple separate efforts going on. One was at the direction of the mayor's office. We worked with the Florida Department of Health to put out all the signage for all the new passengers and people come to the port on the drain and cover program. Separate from that, we have a number of activities trying to make the whole port a safer place. We've done independent testing where we see the presence of mosquitoes. We have 900 drains that exist at the port, and we have a daily program where we have workers go out and chemically treat those drains. Also with our workers who are in the field, we spend an awful lot of time equipping them with sprays and nets so that when they're out working, they'll be safe. The cruise lines themselves have taken a very active role in educating their passengers. So it's impossible to be on a cruise line and on an hourly basis to get messages without covering up. And they're also providing sprays and wipes as well. So we're at least pleased to say, for now, when we've done independent testing, it's been almost no mosquitoes before. So for now, things are going well.
You want to talk about Wynwood? What's going on in Wynwood?
Sure. First of all, thank you for coming back, Mr. Scott, and everybody that's here today. I think this is a group that now, for better or worse, is filled with familiar faces. I think that's for the positive because there is a team effort that's now spanning between the local, the county, and the state levels, and our governor has been gracious to return to Wynwood 3 times since Zika paid us an official visit, so thank you for that. We certainly encourage you to visit Miami Beach. It certainly helps, I'm sure, with the reassurances that the public would love to see their state leader there. But to that end, for our businesses that have shouldered the burden over the last 4 weeks almost now, the economic hit has been quite devastating. We are resilient. We're working together to combat this as a community. We represent the over 400 businesses and commercial property owners that span the 1 mile area that we hear about quite often. And it's important to know that we certainly need your help. I know you have reached out. I know there's an opportunity to engage individual businesses to afford them assistance, but at the state level from your office, we'd like to hear more of that and to reassure them that they don't have to wait 6 months or a year for that assistance. Many of these businesses are small mom and pop businesses that don't have the deep corporate pockets to write off a bad quarter to weather this, this little storm that we have brewing right now down here in South Florida. We attract international visitors from around the world, not just locals, so it's important that we get them up on their feet in time for what is really their peak season now in the winter months that lie ahead, and going into our Basel and big temple events that bring millions upon millions of dollars and visitors. It's imperative that we get that message out now, because those travel decisions are being made in the next 30 to 45 days. So I really would hope that we can work together and get the word out, but beyond just the optics is making sure those packages, those systems are in place so we can deploy them as rapidly as possible, because for some of these businesses, the next few days and the next few weeks may be the difference between them staying open or closing up entirely. So, and that is our delicate ecosystem of Wynwood. We've been at this over for about a decade now, and we can lose this in the next couple of weeks if we don't act quickly. And I do want to acknowledge our county mayor who's here and his deputy mayor, who have been instrumental in working alongside our local city of Miami mayor to work with us in tandem with their efforts. We look to the state and our federal congressional delegation for their assistance, because this is really going to require all arms of government working together.
And I'd like to add a couple of things to that as well. So Joe First, Chairman of the Wynwood Business Improvement District. I'd like to thank the Florida Department of Health, and Lillian in particular, for your work, for your communication. This roundtable that we're sitting at now is really what we would have liked to have seen several weeks ago. So for those of us in the Wynwood area who have communication, direct communication with thousands of individuals, to receive information after the media and then have to be on the heels of that information over the next several weeks has been quite challenging and really devastating for our businesses, as Albert mentioned. I also think it's imperative, as you suggested earlier, and as we know as a fact, the fact that there has not been any active investigations or transmissions that we're aware of in the Wynwood area for well over 2 weeks now. So the idea of the map and the containment of an issue within a map, when clearly over the last several weeks there is no issue within that map, is of critical importance to us. So our request to the CDC and to you as the Surgeon General, and obviously to Governor Scott, is to lift the box and frankly to be, I don't want to say more cautious, but to be very thoughtful about the box, because when the box gets drawn, there's tremendous implications, and it sends an incorrect message to the surrounding communities outside of that box, to where those individuals feel like they have no concern, and as long as they don't come within that geographic area. And we all know that's factually inaccurate. And again, that box has devastating results to the businesses that reside within it.
Right. Is there anybody else?
Oh, go ahead. Just to add to that, you know, my colleagues, the reality of that box is suffocating. And so our businesses have seen anywhere from a 50 to a 60% decrease in revenues. And it's been a message of fear for the last few weeks. I couldn't be happier to be sitting at this table, and we appreciate every single person that is sitting at the table and working really hard to change the message, but the message has to be one of positive. It cannot be about ground zero, and it cannot be about quarantine. You know, and Wynwood is one of the most important cultural destinations in our country, not just in South Florida. And so the ramifications, health is always first. It's always first. But misinformation creates an enormous amount of fear. And so fear to the point of the young lady that I hired this last week, and I asked her to come to Miami, and I put her in a hotel in Miami Beach, and she called me today and she said, you know what, can you put me in another hotel in a different area because that's in the box? Or an Uber driver that usually has 10 trips to Wynwood a day has 1 trip to Wynwood a day. Or people that or servers that are not getting, you know, that are not going to be able to pay the rent. You know, or I'm very close friends with my OBGYN after having 3 children, and he tells me that pregnant women are not even coming to the office for their regular checkups because they're terrified to walk out their door for regular, you know, for their regular checkups. And so that's a scary thing, and it's unnecessary. It really is unnecessary, and we're looking at hundreds and hundreds of thousands, if not more, in canceled business, of event business, and we have to, Wynwood and Miami Beach are some of the most extraordinary destinations that we have in this state, in this country, and we have to do everything humanly possible to remind people how much, why they are that way, and the reasons behind it, and not be afraid of a mosquito. Just like we have, living in Florida, we have to put our sunscreen on every day, now we have to put on our bug spray every day, in addition to our sunscreen.
Governor, I just want to note the presence of two school board members, Vice Chair Dr. Dorothy Bendrus-Mendigal and Dr. Martin Karp, who have joined us.
Good afternoon. Thank you so much to my former colleague, but not my congressman. It's just to thank you for coming. I represent the schools, all of them, that have been noted to be in, and I hate to say this, the zone. I visited 10 schools today. All of them, pretty much, are, as you said, adjacent to the zone. So I wanted to go and to make sure that the children came in with the long sleeve shirts and the long pants. I know it was horrible for them, I understand, but we're doing our very best. I heard you said the superintendent was here, or you'd spoken with him, but you need to know that we're in the same army, and we're fighting very, very hard to make sure that our children are safe, protected. Spoke with parents, spoke with all administrative staff, gathered their needs, made phone calls. We are working very, very, very hard, but it was amazing until we went to the beach. I represented all of the schools. So we're going to work as hard as we can every day to make sure that we educate. And I like the fact that you were talking about changing the message, because we're out here. And thank you so much, the health department. I did my wife's today, Congresswoman. I went in the school, and all of the schools, it's just amazing how much our teachers and all are doing. And I guess this would be the time to say they need a raise. Thank you, Mr. Governor.
I think we have one last question.
Mr. Governor, who determines and what is the threshold for the box to be eliminated? What is the length of time that there has to be no new cases? And secondly, can the people of Wynwood, the business owners of Wynwood and the business owners of Miami Beach, expect the salaries to help them economically, or they go out of business? As there's two questions, I guess, one for the general and one
I'll start with the
for
box. The guidelines for how we determine area of local transmission come from CDC. States did have an opportunity to give feedback, and we expressed concerns about some of the other consequences. I think health is first. I think you put it very well. But we did say that that kind of approach we know would lead to impacts on businesses, etc. And having a job is a health and public health issue, and those that are impacted, we know, and we take very seriously the way that those kinds of decisions can have longer standing effects. That being said, the guidance for the criteria, so how close are two cases, as well as the timeline, how maybe within a few weeks or months of each other, is again based on that CDC guidance. The current language suggests that we would wait 45 days, which is 3 incubation periods, but we are in the process of discussing if there might be some flexibility, and again, as soon as we have more information to share, we will start to do that.
So when you have a disaster, so the state has a role and the federal government has a role. So we're working through our Department of Economic Opportunity with what's allocated by the legislature with the state's role. I asked the president on June 1 how to work with FEMA. I haven't heard that yet. I've asked a few times. So we'll see what if the federal government does anything. But the state's role is through our Department of Economic Opportunity, and they're already in Wynwood, and they're also starting to work in Miami Beach. Thanks everybody for coming today. So everybody feels comfortable calling.
I'd like to recognize Mr. Vincent Delgado.